I'm talking about these people that are alert oriented times 3 that are just assholes. Yeah. I ain't got time for that shit no more. You know what I'm saying? I'm your nurse. I'm not your bitch.
Welcome to the Shift Report.
And welcome back
Episode 6.
Episode 6. You're listening to the Realist RNs, the Shift Report. We're here to just give you guys some raw, real information, delve into our lives as nurses, and really just have you guys grasp what it's like to live in the life of a nurse. Today's topic is probably one of the ones that most people don't really talk about.
Yeah, it's tough. It's a tough one.
It's a tough one because there's so many different aspects to it, right? Workplace violence. We deal with it on a day-to-day basis, but it's also something that's kind of pushed under the rug sometimes.
Right.
And being able to talk about it openly with you guys, our listeners, and even those who are not in the healthcare profession, you guys will be able to delve into what it is like and what is workplace violence and what does it entail.
Right. Before we move on, my name is Wasim. That is Marium. It's always so easy not to introduce yourself.
Yeah.
But it's just a habit.
Right. We're 6 episodes in now.
Yeah.
So I hope our listeners know us by now.
Well, we're learning. At the end of the day, we're out here putting out content for our people, not really focused on ourselves. That's not the point of this.
Right.
So I guess that's kind of why we kind of forget too. But you're right. Workplace abuse, or workplace violence, verbal, physical, emotional. There's so many facets to it. Mm-hmm. I actually was, inspired by a post that I read on Instagram. We are also on Instagram for all you guys out there. We are at the Realist Nurses without the, just Realist Nurses. So there's, we follow and we communicate and we talk to a lot of different nurses all over the world. And as we were kind of planning this next week's podcast, I got in touch with the nurse and she made a post and kind of told her story. So this is the gist of the story here. So she is actually a floor nurse and, she works with patients, probably has 5 or 6 patients. I'm not sure exactly what their load is. She's actually from Australia.
Oh, okay. So she's a nurse in Australia.
Yeah. So she's a nurse in Australia.
Maybe kind of different from what we do here, but
right.
You never know.
So she actually sat down, or she was working, and she was working with a patient who was elderly and required a lot of interventions. So she was in there for probably, 40 minutes to 60 minutes, really, taking care of this patient. And of course, her phone rings, and don't quote me on it. And we'll leave the link to her Instagram here at the bottom of the description as well, so you can read her story and read her post as well. I believe her Instagram handle is nurse_from_AUS as in Australia. So you can link, but we'll link it here for all of our viewers as well. But she was working with this patient and her phone was ringing, or somebody was just kept pestering her. Another one of her patients was just calling her and blowing up her phone, or her colleagues were like, hey, your patient so-so needs you. So of course she's just not going to leave her patient that she's working with.
Right. You just don't leave them will-and-nil to go attend to another patient, even though there's so many times where we're caught in that situation where it's like, just give me a break. Like, let me finish what I'm doing here so then I don't have to backtrack and come back.
Right. And I don't believe it was an emergent call either. So It was just, a patient just needing some attention. So when you're already working with the patient, if you guys don't know, as nurses, we like to finish our task at hand. We're not just going to leave a patient halfway turned or flipped on their belly or, naked. Because, we take care of patients in a variety of ways. So she finally finishes with her patient and she finally attends to the patient that was needing her attention. And I believe her other colleagues were probably busy. They also have other patients as well.
Right.
So she finally gets into this patient's room and this patient just starts cursing at her. Like, where the F you been? This and that. Like, I just need this, that, and just really just hammering her.
Wow.
And if you keep reading her post, I don't want to spoil it, but I will. She wanted a cup of coffee.
Seriously?
This lady wanted a cup of coffee and started humiliating this poor nurse, right? Who's just trying to do good, and attended to this patient as soon as she could. And she started talking about the lack of health care and how it was bad and how they weren't attentive to her, and just blew up at her. And being a nurse, she was, I think she's probably a couple of years into the game. She was heartbroken. You know, you go and lay your life on the line for these people.
Yeah, you do everything that you possibly can for patients.
And then they treat you that way, you know?
It kind of makes you question it. It makes you question, like, why am I even doing this?
Have you had a situation like that?
I have. And I feel like my situation was a little bit different because it was a little bit more dynamic. Because on one end, it was between me and the physician. And then on the other end, it was between me and the patient.
So it was
the physician was covering this patient.
Right.
But I was this patient's nurse. Mm-hmm. So it was like a trifecta. Mm-hmm. And so let's backtrack to the scenario where I have a patient who, I believe she was a 24-year-old female. She was a dialysis patient and stage renal disease. Mm-hmm, mm-hmm. And she was having dialysis that day. So she was scheduled for dialysis that day. Mm-hmm. And so this physician is a nephrologist that I was working with who was on this patient's case. And he had ordered 4 milligrams of morphine along with 4 milligrams of Benadryl simultaneously for this patient who had a blood pressure 90s over 40s already.
Yeah, and
this
for those
is
people
pre-dialysis.
And for those people who aren't listening, dialysis patients hang on to medications longer in their system because they don't urinate. Whereas a normal human being, we're able to urinate out the drugs that we're receiving. And then for someone who has a low blood pressure, a pain medication as strong as morphine can also drop your blood pressure.
So this patient had the nephrologist's cell phone number, and she was calling him directly saying that we weren't giving her her pain medicine, despite telling her that it's just not safe at this time. We're going to prioritize her dialysis and her labs being out of whack before her pain medicine that's every 4 hours.
Yeah, so stuff like clearing out your kidneys.
Yeah.
Over her pain.
Right.
But you'd be surprised how many people don't get that differentiation.
You know, I was very adamant and I was very patient with her, and I explained it verbatim, and she understood. She was a young girl. It's not like she was elderly or confused or anything like that. She understood. And so with her having the physician's cell phone number and constantly calling him, he became upset. And I spoke to him directly and I was like, look, I understand that you have put in these orders. I get it. I just don't feel safe giving these medications to her before she's even had her dialysis.
Right.
So I was like, I'm not doing that. I'm sorry, but I'm not doing that. Yeah. I'm not going to put my license on the line for someone who is walking, is talking, is yelling, is screaming, and cursing at me, but not really in pain. You know, you can tell when a patient is in pain.
Yeah, it's always tough. Pain's always a tough one.
It is tough. And, you know, you want to help them and you want to control their pain, but at the same time, you want to do what's best for them or what's the safest method.
Right. And how long would the pain medication even lasted? She's going to get dialyzed. It's going to all get dialyzed out of her system. She's going to be in pain again in the next 3 hours.
Exactly.
But I guess I understand, like, if she's in pain, that you need to control the pain, but your pressure is going to drop, and then you're going to get dialysis, which is also going to cause your pressure to drop. And then you're on CRRT, continuous renal replacement therapy, which is pretty much slow dialysis, and you're having to move to the ICU for that.
Right. And there was like I said, it was a trifecta. So I have the physician coming at me saying, hey, give her these meds. So then she'll stop calling me. And at the other end, I have this dilemma where I'm like, okay, if I give these meds, it's not going to be safe for her.
Right.
I don't feel comfortable. And so I escalated it because what do you do? What do you do in this situation? When you have a physician giving you one order, you feel like something else is completely just out of whack and does not make sense.
Right.
So I escalated. I asked my charge nurse, I was like, if you had a patient who had a blood pressure of 90s over 40s, that was very variable. Like sometimes it would be 80s over 30s. And so the highest reading we got was 90s over 40s.
Right.
And so I asked her, I was like, would you give these medications together simultaneously for a patient who has a blood pressure like that? And she said, honestly, no, I wouldn't.
Yeah.
And so I was like, so what am I supposed to do in this situation? And she said, I wouldn't give it.
Yeah.
And that's exactly what I did. And I reaped the repercussions because after that, after I said no for like the fourth time, she came into the hallway. And so how our nursing station was set up, it was literally dead in the middle. And then we had 3 wings that came out, kind of like a leaf. And so she was in this very last wing. I was at the nurse's station and I could hear her yelling down the hallway saying, where is my nurse? And there was a patient who was doing physical therapy with the physical therapist down that hallway. And the physical therapist she kind of chuckled because she was like, what is happening here?
Yeah. Yeah.
And the patient saw that and started cursing at her and cursing at the patient that she was working with.
Wow. Okay. So this is just an aggressive person. Maybe it's pain related. Maybe it's more of a character.
So she was really just escalating to the point that we had to call security.
Right.
And she was calling me by my name, yelling down the hallway. And I was like, what is happening? Is this real life? Like, it didn't even seem real.
Yeah. Yeah.
I was like, is this really happening right now?
Yeah.
And so we called security. Security took her back to her room, explained if this was to happen again, like she would not be able to be in the hospital. Like they would discharge her. And eventually she did calm down. They actually switched nurses. So there was another nurse on my unit who was like, hey, I will give the medication.
Right.
And I was like, fantastic, please do. Here you go.
Yeah. Good.
And so she ended up taking over that patient's care. I switched a patient and I took one of her patients for her. And that's how we solved the issue. But my heart was racing.
Yeah.
I was in such a situation and that was my first year as a nurse. So I was a new grad.
Yeah. You were
at the
raw
time.
to all those experiences.
Exactly. So it was completely new for me. My heart was racing. I was like, what am I supposed to do?
Mm-hmm. So you went through verbal
number
enemy.
one, I'm saying no to a physician.
Right.
To a physician's orders.
Right.
And number 2, I'm saying no to a patient.
Right.
Because I just don't feel safe.
Was a physician also giving you flack for it too?
Yeah.
So what was he saying?
He was just like, I put in orders. Why are you not doing this? And I told him I don't feel safe doing that.
Yeah, and you don't have to.
Exactly.
If they feel so compelled, come push the medication yourself.
Right.
You know? This is your license.
I didn't have the courage to tell him that, but in my head, it's something that I was thinking.
Yeah, that's 1 year. Now I'm a decade in. So I've learned a lot. At the end of the day, it's your license on the line. So if you start getting flack like that, screw that. No. Peace. I am doing that because if you mess up and that patient's blood pressure tanks, guess who has to sit in front of the Sentinel committee or review board? You do.
Exactly.
Sure, the physician might be there too. Why did you order that? But you are also on the line. So if the physician feels so strongly about pushing a medicine, all right, you come do it, man.
Yeah.
You know, that's the same with like IV lines. Oh, a patient needs an IV, then come do it. If I can't get to it right now and your patient needs one, come do it. Right. What? You weren't trained to do that? You should have probably learned.
Exactly.
You know, but that sucks because you kind of went through verbal and emotional abuse. Now for this nurse that I was, we're following on Instagram, nurse from Australia, the patient ended up apologizing to her, but she said she was so distraught from that situation. And, I think at that time she was a new nurse as well. She probably accepted the apology. Don't quote me on it, but I think she did. But I'm here to say, like, now, for me in that situation, if if you come out at me the wrong way, I leave. I don't take care of you. And I think there's a precedence on saying there's a difference between providing safe and effective care to your patient versus doing that to somebody who abuses you. And it's not okay in any industry.
Right.
Healthcare. I mean, we have this whole Me Too movement in Hollywood. Like, that's abuse. Yeah. And that's not all right in any format.
Absolutely.
But I feel in the past decade that I've been a nurse that we let it slide a lot.
We do.
We have this culture of just deal with it. No, absolutely not. If someone comes up to me and is abusive or is condescending or disrespectful, I leave. I do my part by finding them somebody else or getting them another resource to get the help they need. I still do that for them. Yeah. But I'm not going to sit there and take that from you. And if you have a boss that tells you that you were in the wrong for doing that, you need to find a new job.
Yeah.
Do not work for a toxic environment like that, because in no way, shape, or form is any sort of abuse from a doctor, a patient, a colleague, a therapist, I don't care who it is, a visitor or an employee or someone just driving by. It's never okay. Because at the end of the day, you're doing your job, but you're not like a product of your system. You know what I'm saying?
Yeah.
That's your job, but you don't lose your self-respect for it.
Exactly.
Ever, period.
And I feel like the hard part was like just seeing that physician after the fact.
Yeah.
And I felt like I didn't have a sense of respect for him anymore.
Yeah, and that's okay.
And after that incident, I kept my distance. I dreaded having any of his patients because that means I would have to interact with him. And of course, keep the professionalism and all of that. And it became very tough though.
Right. And there's a big difference between professional respect and social respect. You don't have to have necessarily social respect at work. But as long as you're a professional and you're respectful in that sense, that's fine. You don't have to be best friends with that person outside of work. You take care of the patients. You know, you act within the scope of your practice. But yeah, absolutely. I wouldn't have respect for him either.
And I didn't. And in a way, I kind of felt guilty. But at the same time, I knew I was being safe. And I went home that day in peace, knowing I did my part. I'm safe. The patient is safe. Everything is fine.
Yeah.
It worked itself out. So in that sense, it was very scary and it was very like emotional, and I was going through all these different things. Like I wanted to cry. I didn't, but I did have the urge to.
Sure. Yeah, that's a tough situation.
It was very tough. So moving forward, I learned so much from that. It's like, it is real. Mm-hmm. And, you know, we have psychiatric patients.
Yeah.
Where we see the physical part of it. And in my current hospital, we don't have like a separate psych ward.
Yeah.
I did in my previous hospital, which was nice because we never really saw psych patients. But now we see those suicidal ideations. We see those bipolars, the schizos. Like we see those on the floor.
Yeah.
And we're not psych nurses. But we have to learn to deal the best way we can.
Yeah.
Different areas of how to protect yourselves when you have a combative patient. Mm-hmm, mm-hmm. And we see that all too often too, especially when we have the elderly, confused, demented patients who, you know, don't really know where they are or what's happening to them.
Right.
But dealing with that and making sure that you're safe, but your patient is safe too. It's not just you that you have to think about. And that's the hardest thing. It's like, no, I have a patient here who also needs to be safe.
And there's two sides to that coin too, right? Like there's times where you'll walk into a demented elderly patient's room and I go and I'm trying to do some sort of intervention, whether it's an IV or give him medications or whatever. And, you know, it's a little Nana and she just starts hitting me and just calling me names like, oh, you and this and that. And in that situation, I like take it.
Yeah.
It's not her fault or their fault or his fault. You know, they're not there mentally. So that's a different scenario. I'm talking about these people that are alert oriented ×3 that are just assholes. Yeah. I ain't got time for that shit no more. You know what I'm saying? I'm your nurse. I'm not your bitch.
Yeah, I'm here to
And I'll
help
put
you.
it out there. Yeah, I'm really not. And the thing is there's labor statistics out now. 1 in 5 labor workers in America go through abuse, or claim to have gone through an abuse, or say they have
I
gone through
believe
some
those
sort of abuse.
statistics 1,000%.
That's saying
Because
that 1
we
in
live
5.
it every day.
Yeah, that's saying 1 in 5 nurses that you work with is abused on the job. I think it's probably a lot higher in healthcare.
I agree.
You know, and that's just crap. So if you're a new nurse listening out there, I know we talked to a long, big range of nurses out there. If you are a new nurse, do not put up with abuse in any form. You don't have to. And if you're scared to lose your job because you walk out of a patient's room and refuse to take care of them, do your part. Find them someone to take care of them in your place, because that's what makes you a healthcare professional. But you don't have to deal with disrespect from anyone. If you feel uncomfortable taking care of somebody, make your charge nurse know, let your manager know, and step away from that situation. If they tell you that you have to take care of it because you're going to lose your job, finish your shift and find a new job.
Yeah.
Because you don't need people who don't support you, because
Right.
that's a toxic environment, and you'll never be able to be your 100% best if they don't let you be.
Absolutely.
So don't do that crap.
Yeah.
You know?
I mean, I think the goal of this episode was to just bring awareness. You know, if you're a patient, appreciate your nurse, because they're honestly, they may take 5 minutes longer than you expect them to be.
Right.
But it's because they're taking care of something else.
And if you have a problem with something, the way someone does something, don't just outright start just barking at them. You know, do it constructively. Tell them like, hey, you know, last time you were an hour late with my medications and I didn't appreciate that. I can guarantee you that person is going to sit down and say, hey, you know what? I apologize. I'm going to do better. Or let's find out a solution to this. But once you start being an asshole, it's just like, dude, I don't even care at this point.
Yeah.
You know, I'm doing what I can. They don't go the extra mile. You know what I'm saying? To help you out. Mm-hmm. That goes with any situation. Screw healthcare. That's just what we're in, the atmosphere, the arena we work in.
Right.
So like, what did you do to solve that problem? So now, okay, you know you have an abusive patient, or you getting verbal abuse from a physician. What did you do to make that better?
Well, that's exactly what I did. I escalated the situation. I went to my charge nurse. I said, hey, what would you do in this situation?
Yeah, so you took it to your upper.
I felt like I was stuck.
Right.
And when she said that she would do the exact same thing that I wanted to do, I was like, all right, that was my validation. Like, hey, now I can do this.
Yeah.
And so she did, you know, I had that nurse who was a more veteran than I was. I was a new grad at the time, to go ahead and take this patient off of my load, and I could take one of her patients. So that's what we did, and that's how we solved the issue.
The other way I think you can also do it when it's patient to nurse is that not enough of us talk about nurse to patient communication, right? So if you feel like your patient is being abusive or is being disrespectful, communicate that to them. Give them an opportunity. Say, hey, that's really disrespectful. I don't appreciate that. If you could please stop, you know, I'd greatly appreciate it. Or please don't say that. That really, you know, bothers me, you know, hurts me. And maybe that patient will stop. Maybe they won't, but at least you gave them a chance. And if they still are assholes about it, all right, fine, whatever. You do what you got to do to be safe and to give care effectively, right? Mm-hmm. And if you have to find a replacement, you find a replacement. But you don't have to put up with it, though. Right. And nobody should make you put up with it.
I just feel like sometimes we're in this customer service environment, like that we put like management or uppers put on us nurses to, you know, patient satisfaction. The patient's always right.
Yeah. And I mean, in most parts they are, but not when they're disrespectful. Don't do it.
And I think there's a fine line between, you know, patient satisfaction and putting up with it. You know, it's like, where do you teeter? Right. Do you put up with it, or do you satisfy the patient because the patient's always right?
So I'd be really interested to know what our viewers are going through. And if you have stories, or if you have situations in which you dealt with some sort of abuse at work, whether it was from a patient or a doctor or another nurse or whoever it was, let us know. Leave some comments below. I'd love to hear about it. It's such a prevalent thing that goes on in the nursing profession, and it's not talked about enough. And it's not discussed.
We don't talk about it, yeah.
So if you want, please leave a comment below. Hit the subscribe button if you're following us along on YouTube. You can also hit the little alert bell in the bottom right-hand corner. It'll give you alerts on whenever we go live with podcasts. We're also on Spotify. We're also on Apple Podcasts and Google Podcasts. If you like to listen to the audio only versions, you can follow us on Instagram at Realist Nurses, or you can follow our webpage at www.therealistrn.com. I hope this episode was valuable to you guys. Next week, since we're getting closer to Halloween, we thought we'd do something a little bit different. We're actually going to talk about a few, I guess, creepy stories that we've had in the hospital settings. There's a lot of life being born, and there's a lot of life that's passing. So that's always a creepy
spooky
time. So we've seen a lot. We've heard a lot of stories, and we're going to be sharing some of those stories next week on our podcast, just a few days before Halloween. As always, thank you guys for listening. We hope this was valuable. We'll see you next time.
Be safe. Happy nursing.
Don't put up with that abuse, man.
The Shift Report.